Ready? Cool. All right. So we are here. We're saying, first off, good morning to each and every one that's here. I know this has been an interesting time. And this morning is really about being honest uh, about where we are. And as a son of a Spanish and English teacher, my mother taught 42 years Spanish and English at the high school level. She would cringe at the title of my talk today to say, I ain't woke. I just can't sleep. Doctoring in the era of racism. Today, I'm going to take you on a journey, and it's going to be one that will feel uncomfortable at points. It will be one that will feel as though we're going to push you a little bit. And then right as that point gets a little too uncomfortable, I'm going to bring you right back. So I want you to go with me. I want you to be okay being uncomfortable, but most importantly, I want you to be okay with however you're feeling. As I travel the country speaking, the phenomenon of being woke slowly but surely became a verb or a cultural phrase that we saw within the Black community. And all the time I would do speeches and people would come up to me and say, hey, brother, have you heard that Henrietta Lacks cells were being used and misused? And I'm like, I just kind of nod like, I got a degree, but whatever, no big deal. And they're like, no, just stay woke, my brother. And then I'll go somewhere else and they'll tell me, hey, have you heard that there's a conspiracy theory about this new drug because they want us and they this and they that? And I'm like nodding slowly. And then, of course, it always ends with stay woke, my brother. And I smile because there's an assumption with this idea of wokeness that it's all shrouded in the idea of trivia. It's often shrouded in this idea that if I don't know something, that makes me asleep, right? That makes me asleep at the wheel. That makes me unaware. That makes me literally a walking dead member of society, right? But in all actuality, if it's all about trivia, if it's all about this idea that I have to know all the little things, but we're forgetting the fight. We're forgetting the idea that just knowing this stuff isn't good enough. Just defining racism isn't good enough. Dismantling racism is why I'm here today. So again, if being woke means I have to define something, I ain't woke. I just literally can't sleep. I'm here to dismantle racism. I'm here not to simply go over more concepts or to tell you things that you can find on Facebook or Instagram. I'm here to actually give us the tools that move us forward and move us along. So yet again, it's really bothersome because so many of us in this woke culture, we're literally asking a lot of questions, but we're not solving any problems. Stay woke. James Baldwin said something that still resonates with me today because this is the idea that is really inflicting our communities in certain ways. But what he says is, in America, I was free only in battle, never free to rest. And he who finds rest, no way to rest, and he who finds no way to rest cannot long survive the battle. Let me read that again. I messed that up. In America, I was only free in battle, never free to rest. And he who finds no way to rest cannot long survive the battle. What I'm learning is the idea of rest within itself is a privilege. What I'm learning, being the 6'5" Black man walking in rooms, that today, if I don't have this suit on, it's exhausting to deal with the racism and the bias and the constant questions about me justifying my presence. I'm no longer here to simply tell people I'm smart. You have the credentials and you're still going to be challenged and tried. You can do the work and you'll still be challenged and tried. But at the end of the day, we are wearing ourselves out in this fight for justice. And this morning, all I want to do is to help you survive this battle. So the first thing I want to do, I'm not here to talk about being woke. I'm just trying to tell you what keeps me awake at night. So the first thing that keeps me awake at night is American logic. I literally have to talk to you about American logic right now. American logic within itself has told us that we have been able to understand how in the 1950s, research came out in the British Medical Journal, highlighting that there were connections between smoking and cancer. Smoking and cancer in the 1950s. Took decades until they got around to the 1980s to understand that now people are bringing lawsuits saying that these tobacco companies were culpable for a lot of the health-related issues associated with smoking. But because they had great legal departments, guess what happened? Always got off. Never had to pay a dime. Then finally, the research pushed it in such a way to finally create the space to say there is a connection between smoking and lung cancer. And then came a master settlement agreement in the late 90s. And this master settlement agreement put literally billions of dollars into the American communities across the country. And what we saw is that they stopped doing ads, particularly with Joe Camel and having cartoon figures, because it looked as though they were marketing to children. So they knew they had to stop the advertising. They knew that we also had to put a warning label on the cigarettes to tell people, hey, this thing is dangerous. American logic. So what we know is that the research took nearly 50 years to catch up with the true reality of the people. But it was never the issue of research simply. It was the issue that their legal divisions were much stronger, much more powerful, right? So our struggle now, the space that we're in now, is that I've seen American logic applied to corn fructose. And as we've seen this, we ask the simple question, okay, so if the government subsidizes corn, and because of the subsidy for corn, they're able to now reduce the price of corn, but then in that same space, they have to ask this question. They say, okay, well, what about the price of other vegetables? What about the price of organic vegetables like a broccoli? So somebody sat down, and I was on a forum one time, and I never forget, I was listening to them engage the idea of how corn subsidies raise the prices of all these organic vegetables. And everybody in the room was nodding their heads, and they were agreeing. People were waving hands, and I'm like, wow, I guess I wasn't woke. I guess I didn't know that, right? So there was this moment where you're saying, okay, so we've made a connection between how the government can subsidize corn prices, and it makes the price of corn lower because we love corn fructose and we got to fry stuff, make our fast food faster. So we have to have a whole lot of corn. So the government subsidizes it, lobbying through fast food industries, from soda people. I get it. But because of that, the price of other vegetables goes up. You ain't got to really understand it. Don't worry about understanding it, because if you get it a little bit, that's cool. But for whatever reason, American logic always fails when it's time to have a real conversation about the consequences of racism. For whatever reason, we're able to link research with smoking and cancer. We're able to link research between the idea of corn subsidies and higher prices of vegetables. But yet we can't understand how a knee on a man's neck for almost 9 minutes I, 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 I ain't woke. I just can't sleep. We're watching the numbers right here in our face. They're telling us that something is going on, but yet our logic is not applied to the statistics. This is a chart that just simply shows a stratification of by race and gender deaths among Black and white men and women. And what we see, the Black men in the big blue in the back, the disparity over the years has come down, but the proportion within itself remains. But American logic suggests that it's the fault of the people, because we want to talk about the individual behaviors. We want to talk about the fact of non-adherence. We want to talk about all these issues that lay and rest on the patient, the individual. But yet we leave society out of the equation. We leave our institution out of the equation. We spend time trying to blame folks for stuff because it's easier to say the reason there's a health disparity or racial disparity in education is because the kids aren't smart enough. The reason there is a disparity in criminal justice is because they're criminals and they don't know how to just follow the rules. So if literally Freddie Gray would have complied, he'd be alive today. If Breonna Taylor, we're here. I can't go there yet. I'm trying to hold off because I got to get through the speech. I'm just trying to set us up real quick. That what we're talking about is this idea that American logic breaks down when we're looking at the research that so many scholars do in this space of racial health disparities. And my problem is, when are we going to get solid enough to keep pushing and keep fighting and keep telling people the same thing, but then have to step up and say, okay, look, I'm tired, I'm exhausted, I'm worn out, because I gotta be a target and I have to be a teacher. I can't be your target and your teacher about racism at the same time. So, oh man, I'm cooking. So let me see. So when I look at the idea of our research on racial health disparities, so this is what my research lab did. We sat down and I said, this is what I want y'all to do. We're going to do 3 searches in PubMed, which, if you're not familiar with PubMed, it's a biomedical research. It's very similar to kind of like a research database for all biomedical literature. So what I said is, this type in racial health disparities, and we're going to do a catchment between 1981 and 2016. And I said, let's just see all the literature that used racial health disparities, just the word itself. And then I said, okay, now do racial health disparities and prevention. Okay, now let's do racial health disparities and intervention. Look what we see. In the dark gray, the line is shooting up through the moon. We're so willing to talk about health disparities. We're so willing to explain the fact that they're different than us. But then when we say, okay, well, how can we prevent these problems? How can we intervene on these problems? What we're seeing is a disparity in the willingness to solve issues. This is American logic at work in medicine. I am absolutely positively not woke. This keeps me awake at night. Because what I know is, if we can't tell our story, not only in how we practice in these hospitals, but how we literally have to exist, and we can't explain it in the statistics because the surveys don't ask questions that are culturally competent and sensitive. We have researchers with less than 2% of NIH-funded grants going to underrepresented minorities. We have to have a real serious conversation. But what else keeps me awake at night? I feel like we have become more willing to dismantle or define racism versus dismantling it. I get more calls to do these racism one-on-one talks. And I said, I honestly don't know why you need a racism one-on-one talk. And I'm just being honest, right? Look, We know historically what racism is. But we also know contemporarily what racism is, because we get in this space where it's like all of a sudden, every single day, I have to have conversations with people and they're like, oh my gosh, I never knew. And I appreciate that you are more than willing to be awakened. Uh, and I appreciate that you are here and we're in this moment. But the problem I have with all of this, and this goes back to American logic just a little bit, is that when we watch George Floyd, 8 minutes, 46 seconds, knee on his neck, and he yelled that phrase, I can't breathe. I can't breathe. The first time I bought a shirt that said I can't breathe on it was about 5 years ago when a man by the name of Eric Garner was choked out and killed using an illegal chokehold on camera. No indictment. No one killed him, according to the city of New York. The only person who got indicted was the person who was filming. And I'm literally standing here raw. I'm trying to keep myself together when I'm saying what I'm about to say, because the first time I had to do one of these types of talks was with a major Fortune 100 company. And it was the day of George Floyd's funeral. And I spent that time in that moment trying to prepare myself for my talk. And I'm trying to prepare to be on a line with 1,000 people on Zoom to talk about racism in America, to not a healthcare organization, but to a corporation that says we want to do better. And before they introduced me, the person who went before me, she was a mindfulness expert. And I asked the folks before they created this training, I said, is she an expert in racial trauma? Because if you just throw somebody up here who's not an expert in racial trauma, you're going to cause more issues than you want to deal with. And the first thing that she said, as she was trying to walk people through this exercise before they introduced Kevin Ahmaad Jenkins, who is a shot no chaser, which is the wrong thing they could have ever done. She says, well, the one thing we can control in our lives is our breath. I can't breathe. That's why they called me. They didn't call me because we want to have a happy-go-lucky conversation about race. They called me because they wanted to have a tough conversation about racism, because a man died on camera saying the same words that another man said 5 years ago. I can't breathe. And now I'm sitting here today finding out that the drywall of an apartment with 3 bullet holes in it could get you indicted, but 6 bullets in a woman in her bed will not. I'm not here to define racism, because we know what racism is, but I'll do it. But I'm really here to dismantle it. So let's get to it. So what is racism? Dr. Kamara Jones, she's literally my Beyonce, right? I always tell everybody she's the Beyonce for all the academics, because she does this work. She's the one who spent time. I should have put the photo of her. She has been gracious with her time with me as I've gone through my journey. But one of the things that she talked about as far as her definition of racism in one of her papers on the levels of racism, a theoretical framework, she said that racism was about structuring opportunity and assigning value based on the social interpretation of one's looks, which we can call race, that unfairly disadvantages some individuals and communities, and unfairly advantages other individuals and communities. Now, the thing that we have to understand is this is about structuring opportunities. This is about this idea that your opportunity for education, for income, for a job, whatever it is always surrounding and trying to dance around the structures. And we're not having real conversations about the structures. How does racism work? I understand the definition, but how does it work? 4 points. Power. So that's the resources. That's the structure of resource. You have power when you have stuff. perception. So I think this about this group. I think if you're Black that I should be worried. I remember when I won the 40 under 40 with the National Quality Health Forum, I was excited. I was one of the, top 40 under 40 leaders in health and all this kind of stuff. I had been presented an award by Congresswoman Robin Kelly. Congresswoman Barbara Lee spoke. I mean, it was dope. I was like, oh my God. So you know what? The next day I went to work. It was in DC. So the next day I went to work, came back to Philly, had on my good suit. I got to work early that morning. I have everything ready to go. Got on the elevator. My office is on the 12th floor, and somebody was already on the elevator when I got on. I'm in a suit. It was about 7:15 in the morning. I'm in a suit, and I go to hit the button to get on the elevator, and y'all know where this is going. This poor woman jerks her purse and jumps to the back of the elevator. And y'all know I'm a little bit hood, so I have problems sometimes because I can't control myself. And I'm really thinking, like, in kind of my Cat Williams moment, like, I'm going to rob you over breakfast? Like, ma'am, it is 7:15 in the morning. I got on a full suit. I just hit the 12th floor. You going to the 8th floor. I'm trying to understand, even if I robbed you, we would have to wait until you get off on your floor. I run off on another floor. So it's kind of odd to me how you think automatically when you see me, be worried. What's odd to me is when I walk into a classroom as the professor, what's odd to me is there's this idea that it's impossible that you are our teacher. It's a perception thing we're fighting. So sometimes it's not just power, it's how we think about people. But it's not just simply saying, okay, power and perception, because that's just prejudice. That you didn't do anything yet. Performance is what's necessary for something to rise to the level of racism. You have to do something. Racism is a verb. It's a verb, and it's one that is tough to swallow for a lot of people, because that poor woman that jumped in that elevator would never think she's racist. It's cool. I told her, though. I was so upset that day when it happened. I went to my office, I sat down, I tried to work for like an hour, and then I just got mad because I was just like, wow, we can rise to all these levels and all these heights of success to still be relegated to a thug with a suit on. When I was at CVS, I first moved to Philly, and I saw this older woman trying to get a thing of water to put on the counter. And I was like, oh, no, I'm country if y'all can't hear it. Listen, my family, we're from Florida originally, Tallahassee, Florida, which is nothing but South Georgia, and in real life. And then my father was in the military, so I was raised in Eastern North Carolina. So either way, I was going to be country. So y'all just got to deal with it, bottom line. So oftentimes I had to slow down because I know I get a little excited. But I remember when I first got there, I'm still a Southern boy. So I see somebody, an older woman with this water. I'm like, no, man, I got it. I got on my balling shorts. It's Saturday. I'm in Philly. I'm getting lost, trying not to turn down the wrong streets. And I finally found this CVS, and I'm like, finally, I can get some stuff. See her, and I'm like, no, I got you. So I put her water on top of the counter, and no exaggeration, ladies and gentlemen, she looked me dead in my face after I put it up there. She said, thank you so much. Do you play basketball? And I was like, no, ma'am, I don't play basketball. And I'm like, no big deal. You get that question a lot. That just means I look young. And the Vaseline my mom used to spread on my face is still there. But the first thing that she said to me after I told her no, she said, well, I'm so sorry. I pray you find your purpose. I wish I was lying. I wish I was lying. This happened. And I'm sitting here thinking, I'm a professor at a Ivy League institution with a PhD, and I have a consulting company and I'm sitting with CEOs and presidents of Fortune 100 companies and 500 companies, some of the biggest institutions, and in these rooms, just being who I am. But yet, because I don't fit the image, I have no purpose to you. And she was able to glean that from me grabbing water and putting it on the counter. So let me ask you a question. How does racism continue? How is it that racism can go from a moment with George Floyd to a movement? The reason it goes from a moment to a movement, and I'm not talking about the protest, the justice, the concern, the outrage. I'm talking about the fact, the reason it's able to even have to rise to that level is because no one feels any consequences for being racist. No organizations have consequences for being racist. We're trying to do a little bit more and a little bit better, but I still want you to think about American logic because, okay, y'all, I'm about to make some people mad and it's okay. So I want you to think about this. Nobody asked for the Confederate flags and statues to come down in 2020. Nobody. I just want to make that perfectly clear, okay? And I want you to hear that from me. Nobody asked for that. We asked for that in 2015 when Bree Newsom climbed the pole in South Carolina to tear that flag down. That's when it was asked for. But because nobody wanted to deal with that, they arrested her. They said, you know what, we'll take the little flag down for a little bit. You know it's bad when Mississippi takes the flag down, right? They take the Confederate flag off their flag, but we didn't ask for that. What we asked for was justice through the George Floyd Act. But they said, okay, no. You know what we'll do? We'll do the pageantry stuff. We'll take some stuff down. You know, we'll tell everybody to do racial training that the president of the United States just took out and said, we're not doing that because that's not American, because that's American logic. And now the reason why racism continues the way it does is because of this word that I like to use, is propagation. It's able to continue because there's literally no consequences. You can kill people with no indictment. You can treat people any kind of way and you won't lose your job. You can create policies for groups of people that literally ravage a community and then say, oh, my bad, we got a vaccine, y'all want to try it. Propagation is the reason why. What I'm saying is we need consequences if we want to dismantle racism. We need consequences if we want to dismantle racism. And sometimes you have to be the consequence. Sometimes it's up to you to be the consequence. Sometimes you got to just go ahead and say, I'm going to step up and say it. Sometimes you just got to say, I'm going to step up and do it. Sometimes the people don't want to get it done and they want to say we want diversity without inclusion. Diversity, ladies and gentlemen, without inclusion is decoration. You cannot keep bringing talented, underrepresented Black and brown people into organizations, but you don't want to hear their voices. You want their visibility because you want to tell everybody, I got new Black people that are really smart. Oh, I have some fun Latinos that are working here now. This is great, but you don't want to hear from them. I shouldn't have done that. I'm so sorry. So when we have these conversations, we've got to be honest. I ain't woke. I literally just can't sleep. What keeps me awake at night is I'm watching people come to me from talk after talk between the health issues, between the issues in organizations dealing with race and racism. We're having problems that we don't want to address. So these social clues that Dorothy Roberts talks about in her book, Fatal Invention, it's these social clues. They're the codes that have been ingrained in us all our lives. It's those same social clues that allow me to say, I don't need to wear a mask when I'm walking up on somebody's house at night. When I go to certain stores, I'm like, put that in a bag, because I was taught you don't just walk out with something in your hand because they're going to think you're stealing. I was taught that there's a certain way you're supposed to speak to people because you got to make them feel friendly. But then the day I realized that no matter what I said, what degrees I have, never mind. I won't do it. I'm going to keep going. I'm going to keep going because that's not fair. I'm going to keep going. Because the thing I want you all to see is that there's also a pathophysiology of racism. That's what keeps me awake at night. This idea that racism isn't just some theoretical piece. It's not just some thing that exists at a 40,000 foot level of society that doesn't do anything. Racism gets in our bodies. Racism gets in our bodies, and most people don't know it. We all say the word stress kills, right? We all say that. Everybody has said it at some point. Oh, you know, stress kills. So is racism a stressor? Is it stressful? Just being Black some days? Is it stressful? Just knowing you're going to go to a conference and you're going to be the only person? My wife is in orthopedic medical device sales. She's a sales manager regionally, and she goes to conferences, and she's literally the only Black woman there. But she runs up in those rooms like a boss and does her job because that's what we have to do. But it's stressful. And that stress within itself, if I'm talking to some of our clinicians, we understand sympathetic overactivity. We understand the fact that when you get stressed out, like that Maytag commercial, you're literally like the refrigerator that's always running. And then even when stress is happening, your heart rate's increasing, your blood pressure's increasing, your blood vessels are contracting and getting smaller, your muscles are contracting and getting tighter, your airwaves, those airways are getting constricted slightly. We're seeing increased gut activity because you're stressed out. But all of those things, that pathophysiology is happening, and we have these conversations in healthy people. What about the fact that we are the ones in our underrepresented communities that are dealing with higher burdens of chronic disease? So when you have kidney disease and stress happens and sympathetic overactivity is triggered, it kills you. It's not simply something that makes you sick. When you have heart disease and sympathetic overactivity happens, it kills you. Psychosocial stress is really that predicate, that kind of mental predicate that allows the pathophysiology to begin, right? So it's that psychosocial stress. It's that moment where you see something coming and there's nothing you can do about it. So all this is saying, if you all play tennis, and if you have a tennis machine and the machine is hitting the ball, throwing the balls at you, and you're like, boop, one ball, right? Another one. Boop. My backhand ain't that good. Y'all saw how bad it was. Boop. But let's say the machine breaks. And now you have two coming at you. Bah, bah, you're good for now. But then let's say it's four. Bah, 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 Breonna Taylor. Bah, oh, I got to deal with this at work. Bah, now I got to deal with it. Oh, you done jerked your purse. Oh, boom, you moved across the street because I was walking at you. Boom, I'm not getting paid as much as you. Oh, my gracious, now I got to go pay an extra bill. Oh, you trying to suspend my son because of why? You say he talks too much, but he's a threat in class? We're always swinging, always fighting. That in itself, our bodies can handle one ball, maybe two coming at you out of that machine, but our bodies can't keep handling this heightened level of social threat. And that's where the physiologic embodiment happens. So when we start talking about racism and induced stress, that's where we begin in our research. In our research, I'm literally saying, okay, y'all keep telling me racism is a public health crisis. Now we're seeing all these states and cities doing this. Don't be fooled, ladies and gentlemen. Because again, don't tell me that racism is a public health crisis, but you won't put any money behind it. You don't have a strategy behind it. You told me that coronavirus is a public. All right. So if coronavirus is a public health crisis and we're struggling getting behind that, what are we going to do next when it comes to racism? So this is how we do it. Most of us hear these kinds of talks and you leave and you feel down and dejected. And what I want to make sure that you understand from me, real as I can say it today, is that everything I said, it can be daunting and it can be tough to understand and feel and hear. But I remember when George Zimmerman got off for the murder of Trayvon Martin. And again, I cried that day, just like I cried with George Floyd, just like I cried with Breonna Taylor's, whatever you call that indictment mess that happened the other day. And I realized with the George Zimmerman verdict that sometimes you've got to find your heartbreak to find your heartbeat. Sometimes you literally have to experience this type of heartbreak to let you know I'm in it. Sometimes you got to be hurt just enough to say, I'm not going to take it anymore. And I think what's happening now in society, we're tired of being heartbroken by racism. And I hope you hear that beat coming, because we're marching. But we're not just marching, we're getting legislation. We're not just getting legislation, we're getting more doctors and more nurses, and we're getting more people who are dedicated to the cause, because we can't do this alone. If you think, oh, everybody has to be black or everybody has to be, not white. We can't do it that way. Finding our heartbeat means we've got to find that thing that gives us the passion to keep going, because this work isn't easy. So I want to share something with you. I want to share this with you, and I'm going to get out of your way in about 5 to 7 minutes. I want to make sure you can hear this. If you can I want to make sure they can hear the video, so I'm not sure if you guys can hear it. No? So what you're seeing is Erica Garner, who is the daughter of Eric Garner. And Erica did an interview. I was trying to show you the interview, but we won't worry about it. She did an interview where she was talking about Kalief Browder's mother, how this young man who was wrongly arrested and literally just sitting in jail with no charges. And he sat there for so long that he killed himself. Nobody said a word. Took Jay-Z to do a documentary to finally get people to care. What I'm starting to understand about this process, she said something. She said, Kalief Browder's mother died of a broken heart. And she said, I'm struggling. I'm struggling too with the stress of it all. She said, I'm struggling with the stress of it all. And it may take me out, but I'm in this fight forever. Her forever ended literally 3 weeks after she did the interview. She died. And on her medical, her death certificate, they said that she died of complications with asthma. And we all know that she really died of complications with racism and dealing with the stress of it. And sometimes, y'all, I can just be honest, this is not an easy thing for us to do, but you can either sit back and be upset and keep talking about the definition of racism and the existence of racism, or we can start dismantling it. We can get upset about the fact that Black folks are dying at higher rates due to COVID and brown folks are dying at higher rates due to COVID and not getting tested and not going through the miscommunication, because we're not just dealing with the pandemic of COVID and the pandemic of racism. We're also dealing with the infodemic, because people don't want to tell us the truth because they don't feel like they have to. They talk to us any kind of way. And today that's going to stop. Dismantling racism is also about getting my respect and demanding that you respect me. And what we're doing now, we're working with the city of Philadelphia, and we're doing a rebranding campaign regarding COVID that is specifically targeted within Black and brown communities. And they tapped me a few weeks ago to do this. So I can sit here and say, oh my gosh, racism is so hard to deal with. But this is a way right here, low key, to get involved. What we're also doing in the VA, we said, I don't want to just talk about racism all day and tell people this or tell people that. I'm creating an actual program that can help clinicians deal with it. I'm creating a program that can actually help our medical educators deal with this stuff. So we're creating what I'm calling RETNA, racism-focused trauma-informed care approach. I know it looked creepy. You saw the guy blinking and stuff. But this is all about saying, if no, you may not be racist as a provider. But if a patient thinks you're racist, that's just the same. Because patients are going to adjust their decisions and change the way they do things or don't do things, right? So why not just anchor this idea around how do we teach people how to talk about racism? Tell me, what are the barriers for you making this decision, for you taking care of yourself? What are the things we need to talk about? It's an extra 3 minutes. That's what I'm able to show with this retina program. It's an extra 3-minute conversation in a clinical encounter that can and will improve outcomes. Last thing, and I'm out of here. For all of y'all that are in this space, as you're starting to get ready to work with patients, and as you're in this field and all of the things that you do in this world, as you keep moving and pushing, remember something. Don't get so emotional. Get empirical. Because people are going to always try to say you're only acting like that because of the color of your, because they think all we do is just get really excited and we don't do anything else. Don't get emotional, get empirical. The other thing is balance your confidence with humility. We are smart people, I agree. We are brilliant. But don't misuse that brilliance on the people that you're trying to help. Don't go to Thanksgiving. Oh, I can't stand it. Go to Thanksgiving and go off on all your family members because you learned a little something new. But then the people who are actually racist and killing you at work, you mute and don't say a word to them. Speak up to the right people. And then lastly, unchecked people go unchecked. I know y'all thought that was going to be something so professional, but we're not empowered enough to check people when they're wrong. We're not empowered enough to tell people what you just said was not right. We're not empowered enough because now that we're in this space of talking about racism, now I have allies who think, oh, let me speak for Kevin in this meeting. You don't have to. Y'all can hear me very well. I don't need anybody to speak up for me. And let me tell you something, and this is on the aside. Don't speak for somebody if you haven't spoken to them. Don't speak for somebody if you haven't spoken to them. I don't need you to speak up for me. I need you to do right. I can handle it myself. So what I'm telling you, young future clinicians, check folks. Because there's nothing worse than going home at night, walking the floor, because you can't sleep because of how they treated you at work. I ain't woke. I just literally can't sleep. You are upset at people, how they treated and talked to you. And guess what they're doing? They're at home drooling on their pillow, not even thinking about you. Check them. And the last thing I say is this. If you want to get through this space, when I was a kid, we used to flinch at each other to show we were tough. You know what I'm saying? Like if you walk up to somebody, you flinch at them, and if you jump, you was a punk. That's what we said. You know, hey, you got to be tough. So what happens over time is that even the scary people can learn how to not be scary anymore because you know they're really not going to hit you. So you just kind of be like, but in that moment, you learn and you're conditioned not to jump. I'm coming home here. For many of us, we go through structures where we're not welcome, and the world is flinching at us. But because of how we were raised and how we were socialized to American logic, we're literally taught not to jump. We're literally taught the performance of toughness is us taking the racism that's been spewed. And I'm so thankful that right now we have an opportunity in the United States of America and all over the world to dismantle racism. And sometimes you're going to think you're not tough enough in this process, but you can make it. Sometimes you're going to think when the world is flinching at you and your classes are hard and you got to deal with all of this stuff and you're thinking, I'm not prepared and I don't deserve to be here, but you're tough enough. You can make it. Don't you ever let somebody steal your heartbeat, because you matter. There's a family that has a child that's not even born yet that's waiting on you. They're waiting on you to become an MD, to save their life. You're going to save lives and change lives but you gotta hold on. So at the end of the day, who I am and who I've become has only been developed by the fact that I had to find rest somewhere along the way. And I'm thankful for all those people who've been able to stand by me and support these messages and these points of honesty. Because I'm only speaking like this because when I was sitting in a classroom, I wished somebody would speak to me the way I'm speaking to you. I thank you so much for your time. I thank you for your opportunities. We're going to make it a great weekend, and we hope to have some questions. I know I probably over a little bit, but thank you all so much. Thank you.
Dr. Ahmaad Jenkins, thank you. Look at this.
Y'all thought I was joking, right?
I'm standing at my full height. Thank you so much for coming and speaking with us and with all of what you just imparted on the students. I have a question for you. Many times we find that students, whether they are in undergrad or in medical school, they are overcommitted and overburdened with student activities and clubs, and they want to do it. And this is some of the things that are therapeutic for them, as far as like I'm involved in BSU, I'm involved with SNMA and some of these organizations, but it adds so much work. Is there specific advice that you give for students, even if they're at the brink and then now living through 2020, self-care, or how can they balance, or I am always of the mindset of telling them, read that stuff. Not saying that you shouldn't do it because it's so important, but you have to get through. So what advice do you give? I think that people listen to you more than they listen to me.
Well, so the question, if you couldn't hear, was effectively for many of our active students, how do you, one, promote self-care, two, exist in a moment of balance, and thirdly, how do you remember what priorities really are? Because what it's hard to say is that, look, I got to deal with racism. Yeah, I got to dismantle all the structures and I got to create Wakanda forever in our own spaces. I get that. But you also have to finish school. You also have to be excellent and get out. You're talking to someone who I was kicked out of my graduate program. I was told that I didn't have the analytic skills to get a PhD by my Black faculty professor, who told me that students who go to historically Black colleges and universities are not prepared for this level of work. When I was kicked out of the program, the day after, I did a program where I spoke right before Charles Blow, who's with the New York Times, and he literally came up to me. He was like, man, I don't even want to speak now. Like, you did that. Like, I'm good. And he and I, we had great talks, great conversations. My frat brother, too, didn't know that. But what was crazy, C-SPAN, and the next day I was kicked out of school. They told me I'd been dismissed from the program because I don't think like them. I was the president of the Black Graduate Student Organization at the University of Florida. I was involved in everything. But the reason I was involved in everything is because I was looking for home, because I didn't find home in the classroom. I teach statistics, and I have a lecture called "And Then What?" based on Young Jeezy's song. And I'm talking about heteroscedasticity and the 5 assumptions of normality, all that stuff. And then I'm like, okay, cool. You found out you got some outliers. And then what? And I remember the first time I did that at Penn, and those students were looking at me like, well, I really don't understand. And then what? What is really going on? And I was like, uh-oh. I had to remember where I was, right? And we're going to always go through those moments. But if you get too involved in stuff that's not going to help you get to the goal, then you're going to be muted and useless, right? They thought when they kicked me out, I was done, and they never see or hear from me again. And now all they do is check my LinkedIn profile because they see like, oh my gosh, how did he get to Penn? I ain't woke. I just literally can't sleep. Fight, yes, but protect yourself, because your parents, your grandparents, and again, it's families that are waiting on y'all to finish. Don't get so involved in these student orgs that it takes you away from the work you need to do, because that's the most important thing, is you getting doctor, getting MD behind your name. Mm-hmm.
How do we start those conversations at work with our coworkers regarding microaggressions and such without jeopardizing our jobs?
I'm just gonna be honest, and I'm gonna say this honestly. Sometimes you might have to find another job. I'm serious. I know that was wrong. I shouldn't have probably said how I feel about it, but I just feel like, you know what? We are constantly in a space of threat. And it's what's amazing to me is it's funny. Somebody will hit you and tell you how to say ouch. And I'm just over it. Like, you can't tell me that when you say something crazy and then I correct you on it. And this is why all of our corporate diversity trainings that I do with all these Fortune 100, 500 companies, every last one of them are literally, I say, I don't want to talk to the employees. I want to talk to your mid-level managers and your executives because you all make the decisions. For you having a conversation with your coworker, does that help? No, because guess who makes the decision? So this is what I started doing. So this is what I do. And this is because of my mom. My mom, I'll tell y'all about that another day if we talk again. But what I do, I bring them all in the room. I want my manager and that person, and we're going to all have a meeting together. And I'm going to say, if it's okay with you, we should record this meeting. And I'm also going to say, if we feel like there's going to be even more problems beyond that, you bring HR involved. They're going to see you as being problematic when you take that approach. But all that really means is I'm watching you. I'm putting a record out there. Because for every conversation that you have where you don't have somebody who you or they report to involved in that, they're the ones who are going to write the report up saying you were the one that was antagonistic and you did this and you did that. So you have to structure your own narrative. Having these conversations sometimes it doesn't have to be so truculent, but there are moments where you have to just get with people. Say what you have to say. Keep your job. If we all need to work and we got to have our bills paid. But also, if you feel like I'm working in an environment where that's all I have to do is fight, it's impacting your health. You're talking to somebody, that process of getting kicked out of school, I developed optical migraines. I had vertigo. I was having all types of issues in GI and all that. That's where my research came from. I'm not just talking to you hypothetically. I live this stuff. And what I'm telling you is the number of call outs that we see for our underrepresented minority employees is much higher because half the time they don't want to come to work and deal with it. So they call out. Then when they get there, what we notice, and this is something that we talk about with our mid-level managers in these workshops, how long are you taking with your employees in one-on-one meetings? What I noticed when I was waiting on my boss, I would sit and listen outside the office and hear whoever they were talking to, laughing, joking, asking about kids, talking about turning up or going, not turning up and but whatever it is. So then as soon as the door opens and it's my turn to walk in, it's straight face. All right, so what can we get to the business of today? There's no chit chat. There's no conversation. So what I started asking mid-level managers to do is record the time that you start and end every one-on-one with your employees. When you can show that you're spending way more time with your white employees than you are everybody else, there's something wrong. And we can say the same about patients. It's no different. But this is how we deal with it. You have to deal with it, but you also have to have some honest conversations. I'm not trying to disrupt people's workflows, but I have to be real with you. Sometimes there's some places that you got to walk away from. And I'm just saying it the best way I can. There's some places that you have to walk away from.
Any questions from here?
I can hear you.
Dr. Ahmaad Jenkins, we want to thank you so much, and we appreciate your time and your talk. Thank you for kicking us off in a wonderful, inspirational, and concrete suggestion way. Thank you so much.
Thank you. All right, let me try to look I'm doing right.